Okay, this model, we're looking at the posterior thigh. Now, on the posterior thigh, we can see the large gluteus maximus, which is superficial. It's a primary hip extensor. And then just adjacent to it is the gluteus medius. Gluteus medius is a primary hip abductor. It's a primary hip abductor, whereas gluteus maximus is a primary hip extensor. So gluteus maximus is a hip extensor, and gluteus medius is a hip abductor. If we look on the posterior thigh, in the anterior thigh, we have the quads. On the posterior thigh, we have the 3 hamstrings. And the 3 hamstrings are referred to as the bicep femoris, and then the 2 semis, the 2 semisisters, semitendinosus and semimembranosus. So the 3 hamstrings on the posterior thigh, we have the bicep femoris, which is the most lateral thigh muscle. And then we have the 2 semisisters, the semitendinosus and the semimembranosus. You can see the 2 different arrows here pointing to the semimembranosus, here and here. And that's because semitendinosus is kind of superficial to it. Now, on the medial compartment, we could still see the gracilis, second longest muscle in the body. Sartorius is the longest muscle. Gracilis comes in second place, right? It's a medial thigh muscle. It's an adductor, hip adductor. Here's the adductor magnus. It's a large hip adductor. It's pretty thick. It's not slender like the adductor longus. Magnus is pretty broad. Okay, from another view, here's the gluteus maximus. It's a hip extensor. Here's the gluteus medius, hip abductor. Here are the hamstrings on the posterior thigh. Here's the bicep femoris, semitendinosus, and here's your semimembranosus. So the membranosus and tendinosus, both those bellies are on the medial side of the thigh, whereas the bicep femoris is on the lateral side of the thigh. Here's the calf, the lower leg. We have the gastrocnemius. This is the medial head of the gastrocnemius and the lateral head of the gastrocnemius. So the gastrocnemius, the calf, has 2 heads, a medial head and a lateral head, and it is dissectable. Here's the soleus. The soleus is deep to the gastrocnemius. Here's the Achilles tendon. So the belly of the soleus is here and here. Now both the gastroc and the soleus are plantar flexors. Okay, they are ankle plantar flexors. The gastrocnemius and the soleus, anything on the posterior leg is going to plantar flex the foot. Anything on the anterior side will dorsiflex the foot. Okay, now if we take this and we take the gluteus maximus and we cut it away, what that's going to show us is this right here. So we cut the gluteus maximus right here, That's the gluteus maximus, the primary hip extensor. It's cut. Here's the gluteus medius. That's the hip abductor. Now we get to the piriformis. Now, piriformis is a hip external rotator. All of these are, in fact. All of these muscles here, whether it's the gemellus superior, obturator internus, gemellus inferior, quadratus femoris, all of these are hip external rotators, all of them. But the biggie is the piriformis. Now, how do you differentiate the piriformis from, let's say, gluteus medius? You find this yellow nerve right here. That's the sciatic nerve. And the sciatic nerve, just superior to the sciatic nerve, is the piriformis. And that's what one of the triggers of sciatica. It's a condition called piriformis syndrome. When the piriformis muscle goes into spasm, it can actually trigger the sciatic nerve. Okay, it's the piriformis. It's a little bit of a typo here. Piriformis is spelled Piriformis. There's no Y there. Okay, piriformis. Piriform. Piriform-is. It's a hip external rotator. Hip external rotator. Gluteus medius is a hip abductor, but it's also a hip stabilizer, so that if you were to stand with one leg on the ground, let's say your right foot on the ground, your right foot is on the ground and your left foot is bent, the left knee is bent, and you're just standing on your right leg, it's your right gluteus medius that contracts to hold your pelvis level. If your glute medius is weak, you wouldn't be able to do that standing on one leg. You'd actually lose your balance. Okay, so there's the gluteus maximus cut, gluteus medius. Find your sciatic nerve. Just above it is the piriformis. It is a hip external rotator. Okay, so if you ask this on an exam, remember the best way to write it is the joint, like hip, and then external rotation, hip external rotation. Not, you don't want to write external rotation of the hip. It's a lot easier to write hip abduction, hip external rotation. Okay, now really nice because you could see the hamstrings that originate right here. So here are the hamstrings, and they originate on the ischial tuberosity. On the ischial tuberosity, that's the bump right there. Okay, let's take a look here.